Good morning, everybody. My name is Caroline Garvan, and I'm a veterinary inspector with the Department of Agriculture. I'm here this morning to talk to you about INAP, Ireland's National Action Plan to Address Antimicrobial Resistance, and the impact of that plan on the animal health sector. I would firstly like to thank the organisers for inviting me here this morning to contribute to this interesting conference. So I suppose just to set the scene initially, why was action needed in Ireland in relation to antimicrobial resistance? The reality is that it was and is a significant global public health issue, and every country needs to contribute to addressing this. Momentum was building both internationally and globally in relation to this issue. But of course, we understand AMR to be first and foremost a public health issue. And so there was the whole aspect of societal self-interest and protecting the health of ourselves and our children, but also addressing animal health and welfare in the context of AMR, and also the whole issue of the environment and the impact of the environment, because we know that AMR is a One Health issue. And finally, then we would have the economic self-interest in terms of addressing inefficiencies at farm and at processing level, in terms of how we produce our food, how we rear our animals, and the whole sustainability of the farming sector. And also finally, the competition aspect, where we have to compete with other countries for markets abroad. So INAP was built around 5 strategic objectives. The first one being increasing knowledge and awareness. The next one looking at enhanced surveillance, reducing the spread of disease, in other words, optimizing animal health. Then also looking at how we use antibiotics to promote responsible use of antibiotics. And finally, the whole area of research and innovation, developing new techniques for diagnosing bacterial disease and other possible therapeutic options. So I've been asked to talk about the successes in relation to INAP from an animal health sector perspective. And for us, really, the key success was the collaboration. INAP brought together all the various industry stakeholders on this issue and really drove this collaborative process, this partnership, and that is what has delivered the key success around INAP. One of the examples is this One Health report, which I have a picture of on the slide. And this was a report on both the incidence of antimicrobial resistance and the use of antibiotics in both the human health and the animal health sectors. So for the first time ever, the collaboration between the human side and the animal health side resulted in the production of this report. As I said, collaboration has been a key success. And on the animal health side, we established an INAP Animal Health Implementation Committee. And what this committee did was it brought together all the key stakeholders in the animal health sector, and they worked together in partnership to address AMR in a collaborative way. I suppose another key success was raising awareness around AMR. And again, this was done through the collaborative process. We had various conferences. The one on the left refers to a joint conference that we had with the human health side. And this was a conference that we had in 2018 for both the medical and veterinary profession. Again, sharing of views, sharing of perspectives. There was also a joint campaign with the Irish Farmers Journal, and this was about communicating to farmers in a meaningful way the issue of AMR and the responsibility that farmers have as a sector to address this One Health issue. There was also participation in various events, be it at Chagas, with AHI. So working with all the stakeholders to communicate and educate everybody from anyone involved in the food production chain, if you like. This was a success in raising awareness, and it was a key focus for the 3 years of INAP. As I mentioned, we established an animal health committee, and this committee adopted an action plan. And so one of the key successes in INAP was delivery of the actions in this plan. There was 54 actions in the plan. 26 have currently been completed, and the remainder are ongoing, and the vast majority will carry on into INAP 2. But this was a key success, to be able to deliver all these actions in partnership with every stakeholder playing a role, playing an active part. We had lead organisations, but then we had other organisations joining under the leadership of these organisations to deliver these actions. This is one of the positive outcomes of the whole AMR issue, of the education and awareness around AMR. We carry out surveillance every year on the levels of resistance in our pig and poultry sector. And in 2016, the resistance surveillance data, and this was the value of the data, showed that in the Irish broiler population, there was a much higher average of positive ESBL producing E. coli in the population. So these resistant E. coli, we were at a level of 68%, which was much higher than the EU average, particularly high when you compare it to our near neighbours in the UK, who are at 20%. So the value of the surveillance data is it highlighted this level, and highlighted the concern to the industry, and the industry stepped in. On the basis of this data, the industry stepped in, and 2 years later, when we repeated that surveillance, you could see the drop in the level of positive ESBL producing E. coli had fallen from 68% to 16%. So this highlights the success of INAP, the success of the surveillance, and the success of industry engagement, of the awareness, of the knowledge of the high levels of resistance, drove this dramatic sea change and interventions that led to the reduction in this ESBL E. coli, this resistant bacteria in our poultry population. So this was a very successful outcome, and the poultry industry in particular have been leading the way in terms of taking on initiatives and interventions to reduce AMR in the poultry sector. Another positive development was the DAFM-led AMU Pig Database, whereby we collect antimicrobial usage data at the pig farm level. And we have had substantial engagement at the pig farm level with this dashboard to allow us to review the use of antimicrobials in the pig sector. And by developing this database, if you like, we have created an awareness in the pig sector that we need to be more aware of how we use antibiotics, and that it is being monitored, and that it is subject to review. Another key success, again on foot of collaboration, was the production of prudent use guidelines, or codes of practice around how antibiotics should be used on farm. And these were developed primarily by farming and veterinary sectors. They came together under the stewardship or the chairmanship of the Animal and Plant Health Organisation to develop these guidelines as toolkits for farmers. So this was an example of collaboration leading to tangible actions and guidance that would promote positive actions on farm. So challenges, I suppose the key issue around AMR is behavioural change. And the challenge currently is, and will remain into the future, how do we change people's behaviour? How do we change it at the veterinary level, at the farming level, at the consumer level, at the retail level? How do we change how we view the use of antibiotics in our food production systems? So behavioural change is a challenge in any industry, and it remains a challenge in addressing AMR. As I said, we are looking as part of our action plan. We have two projects to try and address behavioural change through the use of behavioural science. So we have two projects, one being led by Safe Food, and another where we've engaged directly with the ESRI, who will be following on later, I believe, with a presentation about how we can learn to apply behavioural science to the problem of antimicrobial resistance, so that we can better communicate how our message, if you like, and target our message in a specific way to drive behavioural change. Another challenge for us, I suppose, is maintaining consumer confidence and the whole area of perception around AMR and the use of antibiotics. There is very much a focus on this antibiotic-free message, which is not the responsible message, the responsible approach to take, because really what we want is responsible use of antibiotics. If we go down the antibiotic-free route, we will certainly compromise animal health and welfare, because there are circumstances where the use of antibiotics is very important to protect animal health. And so the consumer needs to be educated, particularly around how we use antibiotics in our animals and how we produce our food. Brexit is a key challenge. It's a key challenge for the agri-food sector, particularly because we are a net exporter of food, particularly to the UK. 40% of our food goes to the UK. We are very dependent on it as a market. The economic impact of Brexit is unknown at the moment, but it is going to impact on our farmers and on our agri-food sector. At the moment, 14.5 billion of Irish food is exported. 10% of the total value of Irish exports is our food. And there has been a continued year-on-year growth in the quantity that we are exporting, from 63% increase since 2010. And so how Brexit plays out, how that market continues to be available to us, is a key challenge going forth to the economic sustainability and viability of our farms. And this also impacts on how we will produce our food and how we will be able to address AMR. I suppose learnings from the whole INAP journey, if you like, one of the key learnings was around consistent messaging. Again, it goes down to communication and how that communication drives behavioural change. And it has been quite a noticeable feedback from our stakeholders at the INAP committee level that we maintain a consistent message so that there isn't confusion out there in how we approach what's needed, the actions that are needed to address AMR. In terms of progress, where we want to go with INAP 2, and this was the feedback we got on foot of a One Health visit from the EU Commission and the ECDC back in October of last year, very much a focus on having measurable outcomes. So we've done all this work around awareness raising and education, and we've developed these guidelines, we've developed a database, but how do we measure that we are actually making progress? This is a key goal in INAP 2. And so to follow on from the progress that we hope to make to INAP 2, a key tool for us going forward will be the new veterinary medicines legislation, which come into force in January 2022. This new legislation, which looks at the controls around the manufacture, supply and use of veterinary medicines, is a new piece of legislation that has been developed with a key focus on AMR and addressing the public health concerns in relation to AMR. So in this new legislation, there are strict controls around the prescribing and use of antimicrobials. Specifically in relation to antimicrobials, a prescription will only be valid for 5 days. And there are strict controls around the clinical examination and assessment required by a veterinary practitioner before they prescribe. There are also key articles in this legislation around prohibiting preventative use of antibiotics. So antimicrobials or antibiotics will no longer be permitted for use to prevent disease. Antimicrobials will only be permitted for use when there is disease has been diagnosed and is present. There are also strict controls around what's called metaphylactic use, or treatment of in-contact animals, where you have large groups of animals together, that antibiotics may only be used if absolutely essential, and justification must be provided. So there is far greater oversight at both the prescribing and user level in relation to antimicrobials because of this new legislation. And so in some ways, yes, this legislation is a very positive thing, but it also requires education and understanding by the key players in the supply and use of antibiotics. And so just to finish up, I suppose, to sum up where INAP 2 will go and what we have learned from INAP 1, the success, I suppose, essentially around the collaborative process, not just within the animal health sector, but with our human health colleagues. It has been a huge learning curve for all of us and very positive engagement with our human health colleagues in the Department of Health and in the medical health sector as a whole. We have also had engagement with the environmental side. We have had very positive engagement, in particular from the EPA. They have been an invaluable support through this One Health journey. They contributed to the development of INAP 1. They sit on our Animal Health Implementation Committee, and they continue to work with us in partnership for INAP 2. So that is the successes. The challenges, as we said, are around driving behavioral change. The learning, I suppose, comes from each other, and it comes around having a consistent message and a better communication with the key players, with the stakeholders in the sector. And then I suppose the progress then we hope will continue around having specific targeted measurable outcomes to demonstrate that we have achieved what we're aiming to achieve. And our overall goal, I suppose, for the animal health sector is the reduction in the volume of antibiotics being used. And so we have done this, or we have focused on how we do this in INAP 1, and the same focus will continue into INAP 2, and that is, first of all, optimizing animal health through disease prevention. Better animal health means we don't need to use antibiotics in the first place, and better economic results on farm, better increased farm profitability. So if you like, better animal health is a win-win for all. But where you do have to use antibiotics, the key word is responsible. So we follow the 6 principles that we have enshrined in INAP 1. We'll continue into INAP 2 around having the correct veterinary diagnosis, because the vet is best placed to diagnose a bacterial disease, that the right animal is treated, so the animal that has the bacterial disease with the correct veterinary medicine. So an antibiotic only works against a bacterial disease. Key for the farmer or the user is that the right dose is given, that is not underdosed, and given the correct duration. And then finally, the whole area of protecting our environment, if you like, in terms of the disposal. So this is how we see the goals for INAP 1, and these are also the goals that will continue in INAP 2, where we will continue to work in partnership and collaboration with all the relevant sectors. So thank you for your attention today. If you have any questions, please upload them onto the app and I will do my best to answer them. Thank you.